Assalamu alaikum. My name is Dr. Khurram Bakai. I am assistant professor in Department of Gastroenterology and Hepatology. So today we are going to perform abdominal examination on a patient. So before starting abdominal examination, we need some prerequisites. Number one, always approach from right side of the patient. Introduce yourself, greet the patient, maintain privacy, and take verbal consent. And then expose the patient. The ideal exposure should be from mid-chest to mid-thigh. अस्सलाम वालेकुम, मेरा नाम डॉक्टर खुर्रम बकाई है। आपका नाम क्या है? अच्छा, आज आपके मुझे पेट का मुआयना करना है, क्या आपकी तरफ से इजाज़त है? ठीक है, मुआयने के लिए आपके पेट का थोड़ा सा खोलना पड़ेगा, कमीज़ ऊपर करनी पड़ेगी, तो क्या इसकी इजाज़त है? तो प्लीज़ आप खुद से कर सकते हैं। सो व्हेन वी एक्सपोज द पेशेंट, वी आस्क द पेशेंट टू एक्सपोज हिमसेल्फ and then we help the patient to get our maximum. The ideal exposure should be from mid-chest to mid-thigh, but if you cannot take the maximum exposure, try to get till pubic symphysis. थोड़ा सा हम पजामे को नीचे कर दें, थोड़ा सा और, ठीक है? The first part is inspection. The inspection comprises of inspection from foot end, inspection from sides, and inspection of inguinal orifices. So first we start with inspection of foot end. We go to foot end, we bend ourselves down, we try to maintain our eye level at the level of patient's abdominal skin, and we wait for 5 to 10 seconds or patient completes his one breath cycle. Now, inspection from side, from the other side as well, and then we inspect the inguinal orifices. We ask the patient to cup, जरा खांस के दिखाइए, दोबारा खांस के दिखाइए, एक दफ़ा और. So we look for the inguinal pulsation to rule out inguinal hernias. The second step in abdominal examination is palpation. It comprises of 3 parts, that is superficial palpation, where we palpate all 9 quadrants superficially, then deep palpation, where we palpate all 9 quadrants deeply, and the third part is visceral palpation, where we palpate viscera, we measure liver span, we palpate spleen, and we palpate kidneys bimanually. Before performing the examination, always ask the patient whether he is having abdominal pain anywhere. आपको कहीं पेट में दर्द तो नहीं है? ठीक है, मैं आपको पेट को दबाऊंगा, कहीं दर्द हो तो बता दिएगा. So palpate abdomen gently, keep looking towards the face of the patient, and look for tenderness, any mass, body temperature, and moisture. Now I will perform deep palpation. थोड़ा जोर से दबाऊंगा आपको. So I am now performing deep palpation in all 9 quadrants. And I am looking for any tenderness, mass, body temperature, and body moisture as well. The third part of abdominal palpation is visceral palpation. Here I am starting with palpation of liver with liver span. I will start my palpation from right iliac fossa, and I will ask the patient to take deep breath. लंबे सांस लेते रहिए. Okay? I will palpate on inspiration and I will move my hand on expiration. So this coordination is very important. Keep looking towards the face of the patient to look for any tenderness. लंबी सांस लेते रहिए, ठीक है? लंबी सांस लेते रहिए, लंबी सांस लेते रहिए, लंबी सांस लेते रहिए. So mark the lower border of the liver, and if you cannot palpate the lower border of liver, the causal margin can be taken as lower border of the liver. So in order to mark, you can ask the patient to place his finger on the lower border of the liver. अपनी उंगली पे यहाँ रख लीजिए. Now we are percussing the upper border of liver. I am starting with second intercostal space, so I palpate the angle of Louis. The second rib joins the angle of Louis. Below this second rib, there is second intercostal space. I am starting percussing, and we can listen the resonant sound. So I started with second intercostal space, resonant sound here. I moved my finger to third intercostal space. I percuss here, again it was resonant. At fourth intercostal space, the percussion node is dull, so it's possibly the upper border of liver. So we can now measure the liver span without moving my finger from here. So this is how we measure the span of the liver. Apni finger hata lo. Now I am palpating the spleen. Okay. Spleen lies at the level of 9 to 11 rib. When it enlarges diagonally towards right iliac fossa. So when we palpate the spleen, we again start from right iliac fossa. We ask the patient to take deep breaths and we palpate on inspiration and we move our hand on expiration. लंबा सांस लेते रहिए. लंबा सांस लेते रहिए. So we palpate on inspiration, we move our hand on expiration. This coordination is very important. We keep looking towards the face of the patient. लंबा सांस लेते रहिए. लंबा सांस लेते रहिए. लंबा सांस. Okay, so I was not able to palpate the spleen. Spleen is not palpable when it is not enlarged. Now I am palpating the kidney bimanually. My left hand or non-dominant hand is at the back of the patient. I am pulling from my left hand. I am pressing from my right hand. So this technique is called bimanual palpation. So now I am palpating left kidney. And for right kidney, again my non-dominant hand is at the bottom of the patient and right hand, that is dominant hand, is at the top, and I am palpating bimanually. So the third part in abdominal examination is percussion. We have two steps in percussion part. The first is shifting dullness and the other is fluid fill. The purpose of both is to detect if there is any fluid in the abdomen. So when we are starting with shifting dullness. We are starting percussion from epigastric area and we can listen the tympanic node because there is gas under the abdomen. I am moving my hand towards left flank and I can still listen the tympanic sound till end. If there is dull sound, I will ask the patient to turn himself toward the opposite side. मेरी side पे जाने करवट लीजिए. And I will wait for 15 seconds. And I will percuss again. So if dull sounds appears, it means the dullness has been shifted. And it can only occurs when there is fluid inside. So if there is dull sound and it shifts after the patient turn himself, it means that shifting dullness is positive. That is, there is ascites in the abdomen. Normally in patients where there is no ascites, we do not listen any dull sound here, and we do not have to ask patient to turn himself. The other procedure we do in percussion, that is fluid fill. अपना हाथ बीच में रखिए. We ask the patient to place his hand in the middle of the abdomen to obstruct any impulse of his abdominal fat. I have placed my left hand on left flank and I am percussing, I am tapping with my right hand on the right side of abdomen. And I am trying to feel any wave over here. So I cannot feel any wave. If there would be any wave, it may be a sign of ascites. The fourth step is of auscultation. In auscultation, we do listen gut sounds and we also listen bruit. So while we listen gut sounds, we can place our stethoscope diaphragm anywhere in the abdomen because gut sound can be listened anywhere in all 9 quadrants. So we have to listen at one place. So the best side to listen the gut sound is right side of the abdomen. So I am placing my diaphragm at right side and I will try to listen the gut sound. So yep, I listen to one gut sound. Now I am looking for the buoy. So I am looking for the abdominal buoy that is just left to midline. We do listen buoy with the bell, and we do not press the bell over the abdominal skin. Left renal buoy at the level of mid-clavicular line at the level of umbilicus. Right renal buoy at mid-clavicular line just below the level of umbilicus, and hepatic buoy just beneath the costal margin at the level of mid-clavicular line. Thank you very much. In the end, don't forget to thank the patient and cover up the patient. Thank you very much. शुक्रिया बहुत बहुत आपका.